My name is Sandra. I'm currently the acting chair of Reclaim Social Care, which is a campaigning group putting forward a transformative vision of social care with co-produced services and community-based services. So due to austerity measures, the user-led self-advocacy project I work for was closed. Since then, I've continued to use my advocacy skills by supporting disabled people, offering advocacy and peer support. But during the pandemic, there was very little acknowledgement of the impact of the pandemic restrictions were having on disabled women, either financially, physically, or psychologically. So, disabled women are a diverse group facing social restrictions that make us vulnerable. So let me be clear, during the pandemic, the word vulnerable had been used for many groups of people, seeing their specific characteristics as the sole cause of their vulnerability, whereas in reality, it's by not taking certain groups of people into appropriate consideration. It is the government and other sections of society that creates the vulnerable situations for them. During the pandemic, an issue that got some government profiling was domestic violence and abuse. What about disabled women? So disabled women are 3 times more likely to encounter domestic violence and power imbalance in relationship than non-disabled women. So recently, I developed a peer support connection with a disabled woman and she told me that due to domestic abuse and family withdrawing of support, she now was left with not enough support to cover her needs. So when we approached social services and asked them to increase the woman's support package, it took lots of time and energy to challenge them to act, as they did not seem to understand the complexity of the situation and even the safeguarding issues that were involved, which were very surprising. So I guess my question for the People's COVID Inquiry Panel is, due to the lack of understanding and inaccessible provision for disabled women needing to flee and find refuge in domestic violence situations, disabled women often end up stuck in abusive environments. How can this be mitigated against in the future? Disabled people, especially disabled people living in the community, actually receiving personal assistance, so direct payments. They really just had nowhere to get PPE. Obviously, they tried to buy it online like everybody else, but there was a shortage, and local authorities did not contact them till quite late on within the pandemic with regards to PPE and how they could access that. So there was no support. So often the people who were supporting them, their personal assistants, they had no PPE because there was none available. People didn't know where to buy that. So obviously, people were left without any sort of protection for a long time. And then I think, people then started to share networks where it was possible to get some PPE. So they did that for themselves, disabled people. They set up that network, started sharing information with each other as a community to try and, get what they needed, really. And it took local authorities several months to get their act together with regards to that. So I think that was a real downfall. So it was almost like, the residential homes weren't getting the correct PPE, as we know, the care workers were supporting people without using PPE. But for disabled people living in the community, there was even more barriers to getting that. Some people got letters to say that they should shield, and then there was other people that didn't, that felt that they should be shielding due to underlying health conditions. So I think that was very hit and miss. I think that the government at the beginning, it did seem as though the government was going to support people by helping them to get food and buy food and even food parcels, but very few people received any support whatsoever. people were very dependent upon the community support that sprung up from the pandemic. And even, you know, accessing and getting that was difficult, unless, of course, you were online. So it was difficult if you weren't a person that was on the internet and could use the internet and social media. So for a lot of older people, they didn't even know that was happening. Um, so and it was very. I think people got confused after the first lockdown because they didn't know whether to shield or not shield. And when they did shield, you know, thought of shielding for so long, you know, not going out, not seeing people, and not having the support mechanisms there. I think a lot of people just sort of give up and did start going shopping and did start going out and about a little bit, you know, trying to be as careful as possible. The isolation of that on a lot of people's mental health, it was just you know, overwhelming. And I think, you know, we're going to see a lot of mental health issues as a consequence of that arising. And even now, people who have shielded for over a year, just being really worried about going out, whether it's safe or just not used to doing that. And we know that for disabled and elderly people, if you don't use your skills, often you lose your skills quite quickly. So walking around, walking any distance, being able to, you know, negotiate things and do things, getting on the bus and all of that, that becomes so much harder if you don't do that on a regular basis. So I think we're going to end up with a lot of people who are very isolated now. And, you know, we've got to look at how we start to support people's mental health, and we support people to get out and about in a safe way. I think, you know, it is about community-based services, and it's about the fact that disabled people's organisations, user-led organisations, were not contacted by the government. They were given no resources or support to be able to use their network. They weren't, you know, so I think that was wrong, because I think, you know, it's important that communities who groups that are supporting communities actually are spoken to and listened to, because they're the people with on the ground information. And I think that didn't happen. And I think in the future, you know, we potentially are going to face even more disasters, you know, with climate change and so on. So it's really important to get that sorted out for the future, because I think it showed a massive gap, really, that the government weren't speaking to disabled people's organisations. The Minister for Disabled People um, doesn't seem to want to speak to disabled people's organisations and disabled people. We have requested that, and it just you know, we've been blanked as such. So you know, so I think that's important that's highlighted, and those networks and those connections are forged by the Minister of Disabled People.